Hi, my name is Mary-Hampton Singleton, and today I would really like to discuss mental illness and mental health as it relates to the healthcare field. This is something that I feel really passionately about, and I don't think enough people are educated on, and we don't talk about it quite enough. According to Natalie Vaughn of Relias, 1 in 5 adults in 2018 suffered from some form of mental illness. At this time also, suicide rates were up 31%. This made suicide the #1 killer of young adults, teens, and children ages 10 to 35, and that actually beats out cancer, heart disease, and a lot of other chronic illnesses, which is a staggering statistic and really crazy when you think about it, because mental illness should be the kind of issue that warrants the same attention as physical health. However, it doesn't. In fact, 56% of adults who want care can't get it, and that's due to insurance issues. Trying to find somebody in network for a reasonable price is difficult. There's also a lack of physician education, and a lot of primary care physicians, which are what most people see, don't know how to treat mental health and mental illness in their patients. In fact, according to the Kaiser Family Foundation, we need about 7,000 more mental health professionals to meet the baseline needs in America right now. And I think there is a really big disparity in the education that physicians and future healthcare professionals like myself are getting. We're not being taught in school how to treat patients with mental illnesses, and that really puts both patients and the provider at a really big disadvantage. The provider is not going to give quality care to the patient just because they're uneducated, and the patients can't find what they're looking for either because there are no resources and they don't know how. Another point I'd like to make is that physicians are not immune from mental illness either. According to Sarah Heath, physicians, clinicians, nurses, administrators are much more likely to commit suicide and suffer from mental illness than a lot of other professions, including active duty military and veterans, which I just find to be crazy that we still can't figure out how to help our own. A lot of times physicians don't get help because they're worried about judgment from others. They're too focused on taking care of their own patients to take care of themselves. And I think this statistic alone is a good enough reason to educate and advocate more for mental illness. At the end of the day, we need more education for clinicians and administrators in school. And we have to make it easier for people to get good quality care. I think that we've made great strides recently, partly due to the newer generation being much more accepting of mental health and mental illness. Gen Zs and millennials have been raised to kind of accept people more, and I think that's a great thing, but we cannot stop there. I believe that physical health should be on the same level as mental and behavioral health, and I think we have a long way to go.